I was telling Lynn this morning that in my work, I'm used to speaking in 2 to 3 4-minute increments. So speaking for 15, 20 minutes is very different for me. And I'm a very good listener. Health Day. Maybe we should have more than one day a year for mental health. It's been in the news a lot lately that we have a crisis, but what's it mean to have mental health? There's a difference between the mental health system and our mental health, our individual and collective mental health. Mental health system in this country has been in trouble for a long time. A long time. I'm getting away from the microphone. Okay. All right. I move around. I haven't been videotaped since I was in graduate school. And the thing my instructor commented on then is I move my hands and I move around a lot. So I try to stay in place. So what's it mean to have mental health on a micro level, an individual level, and on a macro societal level? Just inviting you to be curious with me today, to consider the paradigms that we view mental health through, maybe question some assumptions. I do work as a licensed clinical social worker Monday through Thursday, and I see people who use their health insurance to pay for some part of the cost, and I see people who are totally private pay. I see adults, mostly older folks, and I specialize in trauma. On Fridays, I submit claims for all of my clients who are using their insurance. And on those claims, I have to put down a mental health diagnosis, PTSD, OCD, major depressive disorder, generalized anxiety disorder, phobias. But for both private pay clients and for health insurance pay clients, I'm really concerned about two things. I'm concerned about what brought you here, what are the problems that need to be addressed, and what do you want to see better or different? How will you know when you're done? When we think about mental health versus mental illness, is that a long continuum or is that a binary, two different categories? And who has that power to say what's normal and what's not normal? How you answer that question, who has that power, what's normal, what's not normal, depends on a lot of things. It depends on the country you live in. It depends upon the culture you live in that country. It depends on whether you live in 1200 or 2022. Maybe it even depends on whether you live in 1970 or 2000. Possibly your gender, your profession, different variables. When I was an undergraduate, I was writing a paper on the epidemiology of mental illness. And I came across something that caused me to question how I thought about mental health. It was a Hungarian-American psychiatrist by the name of Thomas Szas, S-Z-A-S-Z. And he wrote a book which upset a lot of mental health professionals in 1961 called The Myth of Mental Illness. And he criticized his profession and he argued against the concept of mental illness. A few of the things that he said that upset people, he said, if you talk to God, then you're praying. But if God talks to you, you have schizophrenia. That's my daughter. She does not have schizophrenia. Okay. He said, is theocracy is ruled by God or priests, and democracy is ruled by the people or the majority, cross your fingers. So pharmacracy is ruled by medicine or physicians. He said, in the past, men created witches, now they create mental patients. Instead of mental illness, Szas suggests that we think of those relevant behaviors and struggles, which we call mental illness, as problems in living. To be sure, you know and I know that to be alive is to suffer. And at some time, in some way, we're going to suffer. And no amount of good looks, no amount of money, No amount of power is going to save you from suffering. And sometimes that suffering and what it results in means that an individual might seek professional help, might end up with a mental health diagnosis. Attempt to gather information about mental illness in the United States was in 1840 in the census, when they were trying to record the frequency of idiocy/insanity. Just one category, kept it simple. But 40 years later, we had expanded to 7 different categories of mental illness: mania, melancholia, monomania, paresis, dementia, dipsomania, and epilepsy. Today in the United States, we have the DSM. She's laughing because in my graduate class on the DSM, I was doing a lot of talking about it at home, and it wasn't really for public consumption what I was saying about it. But the history of the DSM is an interesting study, and it's really just for this country, the Diagnostic and Statistical Manual of Mental Illness. It started in 1952. I wasn't born yet, but I've seen it. It's very thin. It's like a little spiral-bound pamphlet of about 32 pages. It had a total of 106 categories of diagnoses. The most recent edition came out in March of this year, the DSM-5-TR, and it has 1,142 pages with 300 different conditions in it. I don't know what happened. Did we get crazier? Did the world get crazier? But in each of its editions, there have been a lot of criticisms by authorities about it. There's been a criticism that it lacks empirical support, that inter-rater reliability is low for many disorders, and that several sections contain poorly written, confusing, or contradictory information. And that possibly the psychiatric drug industry may have unduly influenced the manual's content, given that many of the DSM-5 workshop participants had ties to pharmaceutical companies. Many changes are apparent in how we conceptualize problems in living, which we see in the different editions of the DSM. As recently as 1973, anybody here alive in 1973? A few of us, yes. Okay. Homosexuality in the DSM was considered a mental illness in 1973. When we think about mental illness, does it matter what your profession is? How much money you have? Does it matter what your gender or your race is? Does it matter where you grew up or where you live? For example, in 2011, there was a massive magnitude 9 earthquake and a series of tsunamis in Japan. You would expect to see a very visible outpouring of grief and despair by everybody who lost so much. They lost loved ones, they lost property. But what the international media observed was this stoical response. In Japan, this response reflected the Buddhist concept of gaman, G-A-M-A-N, which is a nationally held value there, meaning enduring the seemingly unbearable with patience and dignity, as well as a priority placed on social harmony and calm in the face of extraordinary circumstances. Cultural anthropologists and psychologists teach us how culture impacts our psychological functioning. Dr. Dutton at Georgetown University cites the example of emotional suppression. Emotional suppression is not where you're not feeling your emotions, it's where you're keeping your emotions private. You don't need to share them with everybody. You don't need to express them with everybody. She says in American and European populations, emotional suppression is associated with all sorts of negative consequences, both in the moment and long-term. But we don't have any evidence that there are similar negative consequences in Asian populations. We assume that expressing emotions is beneficial, but in Asia, the basic psychological data supporting those assumptions are just not there. What about hallucinations? When I say that word, do you have an image in your mind? Do you have some thoughts about that? Do you think maybe somebody who has hallucinations is a danger to themselves or to others? I actually have had a number of clients who told me about their hallucinations. Visual, auditory. Was that me? Okay. Visual, auditory, olfactory hallucinations. And sometimes they're pleasant. Like I had a patient who heard church music. I had someone who smelled her deceased husband's cologne. So sometimes they're pleasant, sometimes they're distressing. But all of the people who told me about their hallucinations were lovely, gentle people who were very, very functional, and you never would have known. Researchers have shown that people who suffer from schizophrenia and who have auditory hallucinations, such as voices, may hear them differently depending on their social and cultural context. For example, recent research out of Stanford found that patients who suffer from schizophrenia here in our country tend to hear voices that are harsh, violent. But people in India or African countries, they hear voices that are more benign, playful, or even godlike. Throughout history, in some societies, spiritual leaders, shamans, prophets, mystics have displayed certain characteristics that look very similar to schizophrenia. In other words, somebody diagnosed with schizophrenia in the United States might be considered highly creative, holy, even magical in some non-Western countries. How we grow up and how we think about the way the world works is a powerful conduit for how we perceive and embody positive and negative experiences in this life. Meanwhile, back in the USA, the CDC estimates, and this is for you, Marion, the CDC estimates that mental illnesses are among the most common health conditions in the United States. I'm sorry, Marion was one of my professors in graduate school. It's not personal. Yeah. All right, back to the CDC. They say that more than half of us will be diagnosed with a mental illness or disorder at some point in our lifetime. 1 in 5 Americans in any given year is going to experience a mental illness. Last year, suicide rates were up 4% after having declined for the past 2 years. That is a lot of suffering, and it has to be addressed on both the micro level, relief for the individual, and the macro, societal level to support mental and emotional well-being long-term. On a macro level, there's some resources, there's some places that you can look for some help. Gabor Mate, M-A-T-E, he's a Canadian psychiatrist. He's done a lot of great work writing about addiction and ADD. He just recently came out with a new book called The Myth of Normal, Trauma, Illness, and Healing in a Toxic Culture. I've got a copy right there. It's about 500 pages. It's going to take me a minute to get through it. But he says in this book, we live in a toxic culture. Pollutants, hostility, distrust. We need to move the concept of well-being from the individual to the global. He said, illnesses in this society, physical or mental, they are not abnormalities. They are normal responses to an abnormal culture. This culture is abnormal when it comes to real human needs. This is not the first time this idea has been proposed. Back in the 1950s and 60s, it was much more widely discussed. A psychiatrist named R.D. Laing said, insanity is a rational response to an irrational world. You could check out a couple of websites, samhsa.gov, S-A-M-S-H-A, NAMI.org, N-A-M-I.org are good sources for education and advocacy. You can check out the CDC. They have some information about a fascinating study called the Adverse Childhood Experiences. We call it ACEs for short. It was a 2-year study done back in the late 1990s. And it showed that a lack of safety, stability, and bonding, a lack of bonding, safety, and stability from birth through age 17, really prenatal through age 17, impacts us in so many ways long-term. ACEs, adverse childhood experiences, are linked to chronic health problems, mental illness, and substance use problems throughout our life. This includes things like obesity and diabetes. These can be impacted by our ACE score. So you can find more information at the CDC website, and it has a link that you can go and take your own ACE test and see what your ACE score is. Huge majority of us have at least 1 point on the ACE test. But ACEs can also negatively impact education, job earnings. ACEs are costly. The economic and social cost to families, communities, and society totals hundreds of billions of dollars each year. A 10% reduction in ACEs in North America could equate to an annual savings of $56 billion. You get more bang for your buck if you invested early. There's a great book called Lost Connections by Johann Hari, H-A-R-I. He's a journalist who experienced his own severe depression, and he did great interviews with researchers on the subject of depression. This is a book that's written for lay people. It's very accessible, it's very informative, and it talks about why there's such an epidemic of depression these days and what each of us can do if we're struggling with depression. On an individual level, access to professional help varies widely according to income and communities. 1/3 of Americans live in areas lacking easy access to mental health professionals. 1/3. Millions are without health insurance to cover some part of the cost. Those with health insurance may have trouble meeting their deductible, which puts the whole cost on them. Community mental health centers. That was a great idea back in the 1960s with JFK. He said, let's shut down these, I want to use the word asylums, but we'll say inpatient facilities where people are not really getting the care they need. Let's have community mental health centers all over so people can be in their community and have good resources. There was funding given to the states. A lot of it went to funding their pensions, their pension plan. It went to lowering taxes. We do have some community mental health centers, but you know what? They are underfunded. They are understaffed. A lot of their providers are inexperienced new grads, and it's a great learning opportunity if you're a new grad, but there's a huge burnout. If you're lucky enough to get in, and they'll take anybody, they'll take you whether you can pay, what kind of insurance you have, everybody will be seen. And if you can make a connection with a provider there, you might only be able to see that provider once a month because they're so overwhelmed by the need. So that's not really working out for us. What will each of us do? Let's normalize mental health struggles. It's hard to be a human being at any point, but to live in a time of great uncertainty and change, we are all struggling at some time in some way. But people in my experience, they tend to feel alone in their misery. They think, I'm the only one who's not normal. I really loathe that word. I'm the only one who's not coping. So let's show compassion to ourselves and to others and let others know that it's not just them. We all suffer. We all suffer at some time in some way. But we are all tasked with creating joy and making meaning. And we can all help one another with those tasks. The Cheshire Cat said, "We're all mad here. I'm mad, you're mad." But the Cheshire Cat also said, "I'm not strange, weird, nor crazy. My reality is just different than yours."